Welcome everyone to IJIS interview with Indonesian researcher. Today we're going to talk to Dr. April Imam Prabowo.
Yes, I am.
He is a general practitioner working in a clinical academic setting. He received his medical training in UMY, which is in Yogyakarta, and he is trained in both urban and rural setting. He holds a master degree in family medicine from Monash University, Australia, and a professional diploma in tropical medicine and hygiene from Royal Tropical Institute in Amsterdam. He is a member of Department Family Medicine and Public Health in UMY, based in Yogyakarta, of course, and his interest is in the aspect of translational research for doctor-patient community collaborations.
Yeah. Thank you, Bu Yacinta, for the introduction.
Yes. Is there any additional information?
I would like to add a bit about my research interests. It's about the translational research, correct? And then it's about the collaborations of the doctors, the healthcare teams, as well as the community, the patients and the community. And then in particular regarding the primary care setting in the developing countries. So I really would like to put some more effort for myself to contribute to the development of a healthcare system in Indonesia, in particular for primary care.
System in Indonesia, in particular
in primary care setting.
Very interesting, very important topic.
Thank you, Ibu. I was drawn to this topic because I believe of its importance in reshaping the nation's strength, not only health but also the country's strength. And but as a developing countries, there are many challenges regarding the determinants of health, not only from the biomedical perspective, but also mental well-being, as well as the social aspect as well. So that I think as a medical students back then in Indonesia, we were trained with the science of medicines, but not so much about the art of medicines.
Art of medicine.
The art of medicines, and then how we translate that into practicing the medicines for people. So we read a lot of books. We try to memorize by heart everything related to the medications and then the diagnosis, etc. But sometimes we forgot about what exactly the patient experience is regarding disease. And then when we talk about experience, it's not only the patient itself, it's about the family experience, it's about the community involvement. As an Indonesian, you might know that in hospitals sometimes when people sick, a lot of people coming from kampung, from a village, with a bus. It's something that unique and very contextual for Indonesia. And then its uniqueness, it poses challenges as well. And therefore we need to adapt our healthcare, not to change people, but how we make people understand about health, improving the health literacy, but also preserving the community, the uniqueness, the community engagement, how people care about the others, that kind of stuff. Maybe if we purely see it as a medical perspective, like it poses danger to patient safety, and the contaminations, etc.
Yeah.
Of course, we need to think about it.
Infection, yeah.
But regarding infection control, we also want to make it culturally acceptable.
That's right.
That's something that I really would like to explore more about the determinants of health. And then I'm also working at the family planning at the moment. And then therefore, if we're talking about the determinants of health,
Right.
it's not only the policy about family planning that we already have in the past, and we are quite excellent in the past, and now we kind of declined, and then we want to improve it again. But not only with policy, we need to reinvent the way we approach people, and then how we train the workforce, how we collaborate with the community. And then we also have to think about the gender gap. For example, about the decisions of family planning,
Right.
That kind of stuff.
And
then we also have to involve media.
Yep.
In regards to health topics.
Advocacy, talking
Advocacy,
to media, training the journalists to write.
Indeed. I'm currently working at
Not
tobacco
the fake news.
Yeah, I'm currently working at tobacco control as well.
Right.
So the tobacco control involves not only it's a public health issue,
Yep.
but it's also involves taxations issues, economic.
Yeah, politics.
Politics. We're talking industry.
Yep.
We're talking about how we have to deal with the the advertising, tobacco advertising.
Yep.
We're talking about media.
Yep.
We're talking about journalistic.
Yeah. Education.
Educations.
To the
We may not
community.
be able to instantly eliminate the advertising,
Yep.
but we also have to improve the number of education through media.
Right.
Health literacy of the Indonesian people are increased.
Yep.
And then no one's at the better positions other than journalists.
Yep.
So we need to collaborate with,
That's
with
right.
them.
That's right.
So
is
kind of
that
stuff.
what you're hoping here at Monash University? Research collaborations between expert researcher within this faculty.
Monash is a well-developed university, as I was once experienced here
Right.
before. Have abundance of resources regarding a lot of center of studies, and then coming from a rising star university who would like to bring more impact to the society that we live in. I think it's no-brainer to think first about collaborating with Australian University, particularly Monash.
You mentioned gender gap in family planning. Elaborate. Tell us a little bit more about that.
Okay, so Indonesia is quite moderate, and then it's I think the gender gap issue might not be as high as our fellow in Africa,
Right.
for example.
In other countries.
But it doesn't necessarily mean that we already eliminate those parts.
Right.
At least in the sense of, for example, family planning or tobacco control.
Right.
There are some cases or frequently happen about for example the father of the children is smoking, and then the mother could not really tell the father not to smoke near the children and near herself. Not necessarily they realize it's because the gender gap, but we from the academic perspective we realize it's because the gender gap. In regards to family planning, we want maybe the most of the time the husband not necessarily say no, but if the husband can show their support even more, we are certain that the wife or the mother is have more willingness to join the family planning program.
So with that, maybe
kind of stuff.
research to explore and expose that need, desperately need, but also the result of the research can be in the form of educations, our approach towards the father and mother and the family and the school and the children.
Indeed, it's something that I really would like to promote, because when we are talking about public health issues,
Yeah.
and then which in the end affecting the global health status. It's we need to have collaboration with many aspects, and we need to diversify our efforts, not only through the healthcare workforce, but also the community at large. For example, you mentioned about the teachers at primary care or secondary care, for example. If we can put our health program or health education since the beginning, we actually already start the productions of the better generations in regard to health literacy. So they're going to influence their parents as well at home. So they can be a promoter of health.
Model.
And then in Indonesia at the moment, we have Germas, which is a good program, Gerakan Masyarakat Hidup Sehat. And then
so it's in English you can call that the health life, kind of promoting the health life.
I think in English it's a healthy life movement.
Healthy life movement. That's correct.
Healthy life movement. And then also Ministry of Health also has a program with the approach of family as a central part of building healthier community. So with the involvement of family, we have to make sure that every domains in the community, it could be the education system, health systems, and then the security systems, like economy system, has to be able to make the family capable to maintain their health. So we're not only demanding the family to maintain their health, but we want to help them. So that's that kind of stuff that I really would like to explore and then collaborate with Monash.
Thank you.
My pleasure.
It's great that we get to know you a bit more about your background, your what you're planning to do, what you are doing now. Wish you all the best, and thank you very much for spending time talking to IJIS. I'm sure we'll be talking to you soon.
I will. Thank you.
Dr. Afril Imam Prabowo, everyone.